My name is Kayla Hess, and I did my PowerPoint on healthcare reform. Patient Protection Affordable Care Act started in March 2010. It will expand healthcare coverage to 32 million Americans. It provides access to insurance for all Americans through tax credits and premium assistance. Health reform is required due to the largely aging population, increase in chronic diseases, and rising costs. The ACA fosters a preventative health care model that emphasizes primary care, funds community health initiatives, and promotes quality care. It holds insurance companies accountable, lowers healthcare costs, guarantees more choice, and enhances equality for all Americans. For example, they can no longer limit or deny benefits to children under the age of 19 due to a pre-existing condition. If you are under the age of 26, you may be eligible to be on your family's plan. Nurses play a big role. In order to achieve the ACA outcomes, nurses will need to be full partners with physicians and other healthcare professionals in order to develop healthcare strategies that will increase primary care services to meet the consumer need for safe, quality healthcare. Patients are followed more closely within the system during illness and wellness. Hospital stays are shorter. More healthcare services are provided in outpatient facilities and through community-based settings. As demand rises, there is more room for job growth. The goal is to improve healthcare outcomes while decreasing costs. While in the care of a nurse, patients have a healthcare professional working to ensure timely test procedures and rehabilitative activities that foster better and faster recovery. Prior to discharge from a health facility, it is often the nurse who assesses a patient's self-care ability to provide the type of treatments and medications needed to prevent relapse or even costly return to the hospital. The responsibility for optimal recovery is of course shared by all healthcare team members, but the unique position of the nurse at the patient's bedside gives us many avenues to influence care and cure. Though nurses already play a central role in cost containment, care quality, and patient safety, current trends in nursing education have posed the need of greater contributions. The need for continuing education. As patient care becomes more complex, including the addition of evidence-based care, information management system, and increasing team strategies, there is a need for nurses to attain competencies in leadership, health policy, system improvements, among other fields. Nurses must work to be included in advisory teams and boards. We must be active in decision-making processes, must be willing to take responsibility for identifying problems. The data collection needs to be better. Improved information structure. Over 3 million nurses in America are educated under the BSN level. Good bachelor and graduate programs in nursing increasingly incorporate quality improvement in care settings. We work toward better outcomes not only for individuals but also for healthcare systems as a whole. Nursing prepares leaders, administrators, and researchers who can improve care processes and related analytics around outcomes and costs. The coming enactment of reforms included in the ACA will increase the opportunities for nurses to make both individuals and care systems as healthy as they can possibly be. Patient communication, preventative care, and navigation across the vast medical landscape are well-established foci in the curriculum for the nursing schools. These areas of expertise could not be more essential now that new insurance options and Medicaid expansion are bringing millions of individuals into a national primary care system already taxed by provider shortages. Nursing as a profession actively engages in leading efforts to improve patient care and reduce costs. The nurse practitioner's role. It's estimated that the United States has a deficit of over 9,000 primary care physicians. As fewer physicians complete primary care residencies, U.S. population's health care will bring about the increased use of nurse practitioners who can provide primary care. The ACA established a program that allows groups of providers and suppliers to form the accountable care organizations to coordinate care for Medicare patients. This includes nurse practitioners, physician's assistants, clinical nurse specialists. In 2012, 9 states allowed nurse practitioners to treat, diagnose, and prescribe medications without a physician. Patient Protection and Affordable Care Act is the most expansive healthcare reform legislation in the United States since the creation of Medicare and Medicaid in 1965. Nurses have a well-deserved reputation as a trusted source of health information. Student loan reimbursement is offered to nurse practitioners, master's degrees in nurses, and advanced nursing degrees. Medicare payments for services provided by certified nurse midwives will rise 35%. Certified nurse midwives will now receive the equivalent of physician pay for Medicare covered services. Nurses play an important role in the ACA. More nurses are now needed than before. Nurses need to further their education past the associate degree level. Nurse practitioners will be utilized more. More documentation is required by nurses. There is more help and money for nursing students since the healthcare reform.